Hello, I am Dr. Citrus, and welcome back to Holistic Health. If you are a senior or if you are caring for an elderly parent, I want you to listen very carefully today. We are tackling a critical, sometimes frightening subject, the subtle signs your body might give that demand immediate, focused medical attention, especially if you are approaching or have just passed 60. We are going to discuss 7 things that should never appear on an elderly person's body before age 60. A death warning. Yes, I use those strong words deliberately. I know that word warning can be alarming, but my job as a geriatrician is to be your most honest advocate. These 7 signs are not just cosmetic issues. They are the silent alarm bells signaling deep, often silent systemic problems that we routinely dismiss as just aging. This is one of the most vital discussions we can have on this channel because early detection in the senior population isn't just about prolonging life. It's about preserving dignity, independence, and quality of life. Let me start with a story that illustrates why this knowledge is so crucial. I remember a patient, Arthur, a vibrant man who had just turned 62. He was retired, active, loved gardening, but he was starting to show peculiar symptoms. His daughter, Sarah, brought him in because Arthur was starting to forget simple appointments, things he used to handle effortlessly. Sarah was worried about early dementia. Arthur, however, was mostly concerned about his legs. Every night, severe, deep cramps would wake him up, wrenching muscle spasms that lasted sometimes 30 seconds, sometimes a full minute. He'd walk them off, drink some water, and go back to sleep. When I asked him about them, he'd wave his hand and say, "Doctor, it's just the years catching up to me. My neighbor told me to take potassium. I tried that for a month and it didn't help, so I gave up." For nearly 3 months, he dismissed this symptom. He thought muscle cramps were a standard inconvenience of getting older, like gray hair or needing reading glasses. But those painful, persistent cramps, combined with that creeping mental fog, weren't just signs of aging. They were loud whispers of a much deeper, dangerous issue. Severe kidney insufficiency that was silently poisoning his system. His body was failing to regulate vital electrolytes and clear toxins that affect both muscle and brain function. We caught it, thankfully, but we caught it late. Had we addressed those persistent nighttime cramps immediately, that seemingly trivial symptom, Arthur would have avoided hospitalization, a painful workup, and long-term complications that required dialysis management. The cramps were the body screaming about toxic imbalance long before the blood tests showed catastrophic failure. Arthur is not unique. If you are a senior, you're constantly battling the common, dangerous phrase, "It's just old age." We normalize fatigue, pain, forgetfulness, and minor circulation changes until they become catastrophes. We confuse the natural process of aging, which is graceful and slow, with pathology, which is destructive and urgent. If you are a caregiver, I know the terror you feel. You are constantly on the lookout, terrified of missing the one crucial sign that distinguishes a normal day from a medical emergency. You are juggling work, family, and the profound responsibility of watching someone you love slowly change. This fear, this diligence, is absolutely valid. But we must stop normalizing pathology. Aging is not disease. The truth is, your body gives signals. It gives subtle warnings long before a major event like a fall, a stroke, or heart failure occurs. We simply need to learn to interpret them correctly. That is why this checklist of 7 items is so crucial. Today, we are going to be direct and precise. I will give you a detailed, actionable checklist of the 7 crucial physical and behavioral signs that demand an immediate trip to your primary care physician or geriatric specialist before age 60, not after. We are going to look closely at skin and nail health, circulation, gait and balance, cognition, and muscle function. I will explain why these things happen and, most importantly, what specific course of action you need to take the moment you or your loved one notices them. This is not about fear. This is about knowledge. Knowledge is the greatest tool we have for proactive integral health. Please stay with me. Grab a notepad. This conversation could be the difference between a complication and a cure. Let's start protecting your future right now. Let's start protecting your future right now. To truly understand the 7 warnings we are about to discuss, we first need a brief direct lesson on what aging actually is, and more importantly, what it is not. This is the foundation of integral health. When we talk about life after 60, we are discussing a phase characterized by a decreased physiological reserve. Think of your body as a sophisticated bank account. In youth, you have maximum funds. You can spend energy freely, get sick, recover quickly, and your balance resets effortlessly. Aging means that bank balance is lower. Any major physiological withdrawal, an infection, a fall, a sudden stress, can lead to deep overdrafts, or what we call cascading decline. This is where we draw the critical line between normal aging and disease. Normal aging is gradual. It is the predictable, slow loss of hair color or the need for reading glasses. It is symmetric, gentle, and manageable. Disease, particularly chronic disease manifesting early, is rapid, asymmetric, or profound. It is the sudden drop, the rapid weight loss, the confusion that wasn't there last month. Normal aging should not, I repeat, should not lead to a sudden loss of function before the age of 65. If it does, we are dealing with pathology, and that pathology is announcing itself early through these 7 signs. Before we delve into the physical causes, I need to share an essential concept that defines quality of life in later years: the difference between independence and autonomy. We often confuse the two. Independence is the physical ability to perform tasks, to dress yourself, to cook, to drive, to manage your own finances. These are measurable activities of daily living. Autonomy, however, is the fundamental right and capacity to make your own decisions. It is the ability to choose what you eat, who you spend time with, and where you live. Our fight as geriatricians, and your fight as patients and caregivers, is not just to maintain independence, though that is vital. Our ultimate goal is always to safeguard autonomy. The warning signs we are highlighting today, the ones appearing before 60, are threats to your independence first, but ultimately, they are lethal threats to your autonomy because severe physical decline often precedes or accelerates cognitive decline. So, what is happening inside the body when these early, dangerous signs manifest? We need to talk about 3 key systemic shifts that define early disease acceleration. First, vascular stiffness and silent inflammation. Your arteries are the highways of your body. In normal aging, these highways experience gradual wear and tear. In accelerated disease, especially linked to early warnings, these highways become stiff, narrowed, and are constantly subject to low-grade, silent inflammation. This isn't just about cholesterol. This is about the cumulative damage caused by years of unmanaged stress, poor diet, or undiagnosed metabolic issues like prediabetes. This silent inflammation is what attacks organs, the heart, the kidneys, and critically the brain, years before traditional symptoms like angina or severe memory loss appear. The early signs we will cover often stem directly from the brain and the peripheral nervous system not receiving the clean, consistent blood flow they require. Second, metabolic inflexibility and insulin resistance. Our cells become less efficient at using fuel. They develop what we call resistance to insulin. Even if you aren't formally diagnosed with type 2 diabetes, metabolic inflexibility starts damaging tissues decades prior. It's a chronic stressor that accelerates the aging of every system. It depletes energy reserves and makes recovery from even a minor cold significantly harder. Third, and perhaps most visibly linked to the 7 warning signs, is accelerated sarcopenia and the loss of functional reserve. Sarcopenia is not merely muscle loss, it's the pathological loss of muscle mass, quality, and strength. It is normal to lose some muscle as you age, but if you are losing significant functional muscle mass before the age of 60, this is an enormous red flag. Why? Because muscle is our metabolic engine, our protein reservoir, and our primary defense against falls and injury. When the body experiences stress, a high fever, a surgical procedure, or a nasty flu, it rapidly breaks down muscle for protein and energy. If a person under 60 has already lost a significant amount of functional muscle, that person enters a state of frailty years too early. Frailty is not a diagnosis of weakness. It is a diagnosis of vulnerability. It means the body has lost its capacity to mount a successful defense or recovery. When you see one of our 7 warning signs appearing early, it is often a direct result of this trinity of internal breakdown: stiff arteries, poor metabolism, and depleted muscle reserve. The 7 signs we are about to discuss are not minor inconveniences. They are the physiological manifestation of accelerated aging and chronic disease asserting dominance over your functional independence. These signs are visible proof that the silent battle against inflammation and metabolic decline has moved from the laboratory test results and into your daily physical life. Your role, whether you are the patient or the caregiver, is to be the primary observer. You are the only one who can spot the subtle shift from the normal curve of life to the dangerous, sharp decline associated with early disease. We must treat these observations as urgent intelligence. They are the body's final direct communication, whispering a warning of mortality that you simply cannot afford to ignore. Let's now look at these 7 vital observations. We will be direct, clear, and clinical. This is what you need to look for, starting today. The observations we discussed, the unexplained weight loss, the sudden profound confusion, the persistent bone-deep fatigue, these are not just symptoms of aging. They are emergency alerts. They demand a swift, calculated response, not just from the patient, but critically from the entire care team. Let us transition now from identifying the threat to executing the safety protocol. This is the practical framework, the step-by-step guide that allows us to not just extend life, but radically improve its quality and combat those urgent warning signs. The first step, the cornerstone of this entire protocol, is what I call the immediate medical triage. If you observe one of those 7 severe signs, especially rapid decline in memory, sudden mobility issues, or unexpected persistent bleeding, you do not wait for the next scheduled appointment. You contact the geriatrician or primary care physician today. When you make that call, whether you are the patient or the caregiver, be direct and clinical. Do not simply say, "Dad is tired." Say, "Over the last week, his activity level has dropped by 50%. He slept 12 hours yesterday and is still unable to stand unassisted. This is a significant change from 2 weeks ago. We need objective data to act quickly. If weight loss is the issue, provide the exact numbers. If confusion is the issue, document the specific instances and the duration. These concrete facts expedite the diagnosis and bypass unnecessary time-consuming testing." Now, let us move to the 4 pillars of long-term defense, the necessary changes that directly counteract the primary causes of vulnerability in the aging body. Pillar 1, the medication audit, the polypharmacy danger. For many older adults, the biggest threat is not the disease itself, but the synergistic effect of multiple treatments. Polypharmacy, the use of 5 or more medications, is rampant, and it is a leading cause of those red flag symptoms like confusion, dizziness, falls, and severe fatigue. You need to schedule what I call the brown bag review. Gather every single item the patient consumes: prescription drugs, over-the-counter pain relievers, vitamins, herbal supplements, even specific teas marketed for health. Place them all in a single bag and bring them to your physician. The goal of this review is simple. Are we using a medication to treat a side effect caused by another medication? This is a cycle we must break. Your geriatrician must rigorously question every pill. Why are we still using this? Can we lower the dosage? Can we substitute it for a non-pharmacological solution, especially for sleep or mild anxiety? Do not stop any prescribed medication on your own. This is critical, but you must advocate for a comprehensive annual cleaning of the medicine cabinet under professional supervision. If a sign like lethargy or sudden confusion persists, the first clinical response is often a simple blood test to check medication levels, followed by a reduction in dosage or discontinuation of one of the culprits. Pillar 2, the anti-sarcopenia protocol, movement as medicine. Sarcopenia, the age-related loss of muscle mass, is the silent killer and a massive contributor to several of the 7 warning signs, particularly mobility issues and persistent weakness. It is non-negotiable. Physical activity is medicine, and you must prioritize strength. When I speak of exercise for the elderly, I'm not talking about running marathons. I'm talking about resistance and balance training, customized, consistent, and safe. The protocol has 2 components. First, resistance training. Muscle mass is necessary to protect the bones and metabolize nutrients correctly. We must maintain it. This means using resistance bands, light dumbbells, or even simply the person's own body weight. Simple chair stands, the act of sitting and standing 10 to 15 times, multiple times a day, are profoundly effective. Second, balance and flexibility. Falls are a direct consequence of weakness and poor proprioception. Incorporate gentle activities like Tai Chi, which is exceptional for coordination. Even standing near a kitchen counter and practicing standing on one foot for 10 seconds, then switching, can dramatically reduce the risk of a fatal fall. Consistency is more important than intensity. Even 3 short, supervised 15-minute sessions a week are exponentially better than nothing. If the patient is frail, start with physical therapy assessment. You need a baseline and a personalized plan. Pillar 3, strategic nutrition, fueling the fight. If we are asking the body to fight decline and maintain muscle mass, we must provide it with adequate fuel. Nutritional deficiency is often overlooked, leading directly to unexplained weight loss, fatigue, and poor wound healing, all red flags. The focus must shift from simply eating enough to eating nutrient-dense foods, with a specific emphasis on 2 key areas: protein and hydration. A, protein power. Protein is the building block necessary to fight sarcopenia. General recommendations for older adults often fall short. We recommend a higher protein intake, often between 1.0 and 1.2 grams per kilogram of body weight, especially if the individual is recovering from illness or is already frail. This means prioritizing lean meats, fish, eggs, dairy, and legumes at every single meal. If appetite is low, a common warning sign, consider high-quality protein supplements like whey or specialized nutritional shakes. These supplements are not optional. They are a necessary medication designed to prevent malnutrition when solid food intake is inadequate. B, hydration. Dehydration is a massive trigger for confusion, fatigue, and even falls. The thirst mechanism diminishes significantly with age. The elderly often do not realize they are thirsty until they are already critically dehydrated. The protocol: consistent intake even when not thirsty. Keep water, clear broths, or decaffeinated beverages within arm's reach at all times. Monitor urine color. It should be light straw yellow. If it's dark amber, it is an urgent sign of poor hydration and potential impending crisis. Pillar 4, home adaptation, the fall prevention fortress. If we are seeing warning signs of mobility decline, The environment must change immediately. The home, intended as a sanctuary, often becomes a hazard. This adaptation is a proactive measure against falls, which frequently initiate the spiral of mortality in the elderly. We must eliminate obstacles and enhance visibility. First, remove the trip hazards. Area rugs, loose cords, excessive clutter, these must go. If a rug is absolutely necessary, ensure it is thin and securely taped down at the edges. Second, enhance lighting. Poor vision and poor light are a deadly combination. Install night lights in hallways, bedrooms, and bathrooms. Ensure light switches are easily accessible. The path from the bed to the bathroom, especially at night, must be illuminated. Third, secure the bathroom. The bathroom is the most dangerous room in the house. Install sturdy grab bars next to the toilet and inside the shower tub area. Use non-slip mats or specialized treatments for the shower floor. Consider a shower chair if balance is compromised. Fourth, easy access. Make sure frequently used items, medications, water, phone, are within easy reach of the main resting areas. Minimize the need for stretching or climbing. These 4 pillars, the medication audit, structured exercise, strategic nutrition, and home adaptation, are your immediate battle plan. They directly address the systemic vulnerabilities that those 7 warning signs indicate. Remember, the goal is not merely to treat symptoms, but to enhance systemic resilience. When we manage polypharmacy, build muscle, ensure adequate protein, and secure the environment, we are directly counteracting the forces that push the body toward frailty and decline. This is not a list of suggestions. This is a directive. The time to implement these changes is not tomorrow or next month. It is now. The communication from the body is urgent. Our response must be equally decisive. Be vigilant, be clinical, and above all, be proactive in securing the health and dignity of every year ahead. You have absorbed a clinical, perhaps uncomfortable truth today. We discussed the 7 urgent signals, the body's cries for immediate intervention, that should absolutely not be manifesting before the age of 60. This is not fear-mongering. This is a direct, data-driven conversation about preemptive life preservation. Understanding the why behind this list is crucial. These aren't isolated irritations. They are the 7 pillars of functional decline. When they appear prematurely, they signal systemic distress, a distress that is often reversible if caught in its absolute infancy. Let's quickly cement these 7 non-negotiables in your memory one last time, because they must become your immediate checklist. We are not talking about common aches. We are talking about rapid, unexplained weight loss. We are talking about acute, sudden onset of confusion or delirium, a dangerous deterioration in gait, balance, and mobility leading to falls, persistent, debilitating fatigue that sleep cannot remedy, unmanaged or newly severe chronic pain that dictates daily life, the appearance of strange, large, or rapidly changing skin lesions that demand biopsy. And finally, the life-threatening duo, severe appetite loss and persistent dehydration. If we find one or more of these signals, we do not wait, we do not rationalize, we do not assume it is just old age. That phrase, just old age, is the single most dangerous phrase in the lexicon of caregiving. It is often a cover for an underlying treatable condition that is aggressively stealing independence. Your years ahead, regardless of your chronological age, must be marked by dignity, autonomy, and vibrancy, not by being tethered to preventable illness. The ultimate purpose of geriatrics is not merely to extend life, but to extend the quality of life. When we intervene decisively on these 7 points, we are fighting for years of independent living. We are fighting for the ability to continue doing the things that bring meaning to your existence. For the caregivers watching today, you are the medical detective. Your vigilance is the first line of defense. Do not just treat the symptom, investigate the cause. If weight loss is the problem, is it due to depression? Is it dental pain? Is it the side effect of a polypharmacy issue? Too many medications interacting? If the confusion is new, is it a hidden urinary tract infection? Is it a fluid imbalance? Geriatric care demands holistic precision, and it demands action based on solid data, not guesswork or fatalism. My directive remains clear and urgent. Use this knowledge immediately. Take this checklist and share it with your family, with your primary care physician, and ideally, consult a certified geriatric specialist. We specialize in the intersection of these complex issues. We do not accept vague answers. You have the right to quality, integrated care, and you have the clinical necessity to demand a thorough, integrated assessment right now. Remember this: health is not a lottery, it is a discipline. It is a shared responsibility between the patient, the family, and the medical team. We have given you the definitive tools today to enforce that discipline. Look after yourselves. Look after your loved ones. We are here every week on Integrated Health to guide you through the complexities of aging with clarity and compassion. If this message resonated with you, if it armed you with necessary knowledge, please take a moment right now to subscribe to the channel. Your support allows us to continue delivering these life-critical directives. More importantly, share this video. Share it with every family you know who is navigating the responsibilities of caregiving. Your share could literally save a life by prompting a crucial early appointment. Thank you for trusting me with your health journey. Until next time, stay vigilant, stay strong, and live every year with integral health.